So I'm going to talk a little bit about starting a PrEP service, which we started at the Thai Red Cross AIDS Research Center back in 2014. Yeah. So, and nothing to disclose yet, but if anybody wants to offer me something to disclose, I'd be happy to talk to you after the talk. So this is where I've worked for the last 6 years at the Thai Red Cross AIDS Research Center in Bangkok. It's housed in a couple of what I'm told are former water towers, and I'm told that there's not millions of gallons of water on top of us every day, but who knows. And if you've ever been to Bangkok, we're located halfway between Silom Road, which is sort of the center of the gay nightlife in Bangkok, and Central World or Siam, which is kind of the center of shopping, which is kind of the national pastime in Thailand and in much of Asia. So the Thai Red Cross AIDS Research Center sent up the anonymous clinic back in 1992 when Thailand was first hit with the HIV epidemic. And it's the largest HIV testing center in Thailand and currently does over 40,000 HIV tests per year. That comes out to about 200 tests per day. Now we're going back to November 2014. If you remember, the first evidence for PrEP, the IPREX trial came out, I think, in 2011, but it kind of took a few years before things started rolling with PrEP. So back in 2014, in the HIV testing center anonymous clinic, we had an HIV prevalence of 20%. Among MSM. In the non-MSM, it was still high, 6%, but in the testing center, MSM were about 1/3 of the clients coming in for HIV testing. But as mentioned, we have a cohort of acute HIV infection. We have an algorithm for identifying acute infections. And although MSM were a minority of the clients coming in for HIV testing, they were 90% of all acute infections. And at that time, we were identifying about 2 acute infections per week. So we decided we had to do something, so PrEP was out. So we decided, okay, what can we do? How can we get PrEP out to the people who need it as quickly as possible? So the first thing we did was said, well, what do we need to do in order to get PrEP? So this was the kind of checklist that we came out with at the beginning. So first you need the human resources, right? You need a prescriber. Most places that's going to be a physician, or in some places possibly a nurse is able to do that. You need to do HIV testing, so you have to have a testing counselor, which could also be the doctor or the nurse. You need a pharmacist to dispense the PrEP drug, and you need to be able to do a blood draw as well. So, and possibly only 1 or 2 people can do all of those things. You also need the laboratory services, so you have to be able to do the HIV test, because we always want to do an HIV test to rule out HIV before starting PrEP. You need to test kidney function, because the PrEP drugs can affect renal function. Screen for hepatitis B. Not that hepatitis B is a contraindication to PrEP, but the drugs we use for PrEP are also treatment for hepatitis B, particularly in Asia, where the prevalence of hepatitis B is 5 or 10% in the general population. We want to know if somebody has hepatitis B, not to start PrEP, but just in case we need to stop it in the future, because those people, maybe we won't stop PrEP, maybe we'll continue it to treat their hepatitis B. And then the STI testing, which is always recommended in any guideline, but particularly in Asia, where resources are limited, we really make that optional, because we want to take away any barriers there are to starting PrEP. And as I'll show you later, the cost in Asia, at least, the cost for one STI, the one PCR for chlamydia and gonorrhea, that costs more than doing PrEP, the whole cost for PrEP for a month. So we make that optional. Of course, you need the pharmacy services too to provide the PrEP drug, and you need to prepare. So if you look at this checklist, you can see 1, 2, 3. If you're doing ART, you pretty much have 1, 2, 3 already. So you really have all the infrastructure you need to start PrEP, and then you really just need to go to 4, which is where we work in our clinic. We had everything we needed, but we just needed a protocol and then train up the staff. And so in our case, that only took a month from the time we decided, well, we should be doing PrEP until we actually started it. Only took a month. So we launched that in December of 2014. It was the first publicly available PrEP service in Thailand outside of clinical trials, because there were some clinical trials that had been done in Thailand and were ongoing at the time. And really the first publicly available PrEP service in all of Asia at the time. So it's fee-based without a subsidy. I said it took only a month to to get this started. So there was no time to write a budget or ask people for money or get funding, anything like that. And because the Thai Red Cross is a nonprofit, we were able to offer it at cost. So we didn't need to make any profit. We just needed to cover our costs. So when we first started, the total cost was 30 Thai baht per day, and that's about $1 or less than €1. And we're able to do that because we had access to generic PrEP medication that was actually produced in Thailand at the time. And then the testing costs in Thailand are quite low, and then the staffing costs are low too, so the fee for the clinic is actually quite low. So we used the existing VCT clinic, existing staff. We didn't have to hire any new staff. We came up with a simple protocol for the VCT counselors to screen participants or clients who come in for HIV testing, if they would be appropriate for PrEP or not, and then if they sort of pass the screening, then we referred to a physician to prescribe PrEP or at least to counsel people about PrEP. And then we also did PrEP on same day. So if somebody came in, their HIV test was negative, we can offer PrEP on the same day. Now, some of the other tests, like the creatinine test and the hepatitis B screening, usually we would not have back the same day, but we would get that back the next day. And then we would get the person's phone number, and if their creatinine was high, then we could call them back and have them stop PrEP. And taking 1 or 2 doses of PrEP isn't going to really affect your renal function that much. So I said we at first we called this PrEP 30 because it cost 30 baht or $1, but actually this year we had to change it to PrEP 15 because the cost of the drugs has come down so much, and now we're actually able to access low-cost generic medicines from India. We're actually cheaper than the medicines produced in Thailand. So now we got it down to 50 US cents, or about $15 per month. So as I said, we were the first program to offer PrEP as a service in Thailand in 2014. But since then, of course, there's more programs coming, some programs through the government, some funded through external donors like PEPFAR or USAID. So now you can see there's kind of a number of programs, and in the middle in Bangkok, you can see 6 different programs that are providing PrEP. And many of those programs also provide it for free. People can walk in and get it for free. And so I really thought, well, once free PrEP comes along, who's going to pay? Even though the cost is low, it's only $15 a month, but who's going to pay if you can go, a kilometer away and get it for free? But I was actually wrong about that. So this shows how many clients come in per month. So when we first started, it was actually quite a challenge to get people. So even though we had like a very high-risk population coming in, 200 people a day coming in, 30% were MSM, they had a 20% prevalence rate. At the beginning, nobody had heard of PrEP before, so it really took some kind of education for the people coming in and for the community, so people were aware of PrEP. And then willing to take it. So when we started, we were only getting about 5 or 10 people per month starting PrEP, but actually this year now we're up to over 100 new clients per month starting PrEP. And this is the cumulative over time, and the last update of this is April of this year, and we had over 3,000 people who've started PrEP at the Anonymous Clinic. This slide just shows all the different programs that are providing PrEP in Thailand. So the blue bar on the bottom is the PrEP 30 or PrEP 15 now. The gray bar is another program we call Princess PrEP. Princess there maybe means a little different than some of you are thinking, but it's actually the actual princess, so the sister of the current king of Thailand, who had generously donated money for many years for the mother-to-child prevention program in Thailand. But actually, Thailand is one of the first countries in the world to declare an end to mother-to-child transmission, so there's less funding that's needed for that now. So they were able to redirect the princess's contribution from the mother-to-child transmission to PrEP. So, and that's offered free. And you can see as of this was updated just about a year ago. At that time, there's about 5,000 Thai people taking PrEP at that time. This graph was put together by my boss at the Thai Red Cross, Nitya Panopak, and the reason we don't have any update after that is because she just said, it's not my job to do this. Somebody in the government or the Ministry of Health should be doing this, so she stopped doing it, and nobody else is doing it since then, actually. So some surprises that come out of this program. So the first thing is, like, if you build it, they will come, right? So if you provide the service, then people who need the service are going to come, and may not necessarily be the people who you think they are. So one is that we have the service, anybody can access it at a very low cost, and actually a very high percentage, 39% of the clients who come in for PrEP now are actually not Thai people. They're people coming in from other countries, and basically because they don't have PrEP available in their country. It's easy to get to Bangkok. Bangkok is always at the top of the list. Bangkok and Paris are like the two most visited cities in the world. Bangkok gets over 50 million visitors per year, and it's also kind of like the gay center for Bangkok, for Asia. So just about every gay person in Asia comes to Bangkok at some point for a holiday. This just shows the different regions that people come from. On the right half of that pie is China, ASEAN, which is Southeast Asia, and other Asia. So half of the foreigners are coming from Asia, which makes sense because they're all in the area. But you can also see big numbers from Europe and from North America as well. So I just did a little math. So 22% of the foreign clients are from Europe, and you can see just a little math. It means about 258 Europeans have accessed PrEP in Bangkok. And then I went through the list. So people can, when they register, it's anonymous clinic, so you don't have to give your name. People usually just give initials. And if they're foreigner, they can list the country that they're from. But of course, that's optional. Not everybody lists it. But I got the list of all the European countries that, citizens of these countries have accessed PrEP in Bangkok. And if your country is not on there, let me know, because I think probably just about everybody in this room, someone from your country, has accessed PrEP in Bangkok. So the other thing that I was surprised about was, as I said, in Thailand, or in Bangkok at least, 90% of the acute infections or new infections are among MSM, and we created this service really kind of catering to that community because that's the community that seems most at risk. So I thought, well, 90-95% of the people coming in are going to be MSM or bisexual men, but it's actually closer to 80%. So there's a lot bigger sort of a need or demand for PrEP in the heterosexual community than we were expecting. And we also see some interesting differences in terms of the risk factors who's coming in. So this just shows the self-reported risk factors among the MSM clients, and it's kind of what you expect. They're having sex without condoms, and having multiple sexual partners as well. But if you look at this one's the heterosexual females, maybe there's also multiple sexual partners, condomless sex, but much higher in terms of having an HIV positive partner. So there's women who have a male partner who's HIV positive, and then of course sex work is higher as well. And I think that among both the men and female clients, that sex work is probably underreported just because it's stigmatized. And this shows the heterosexual males, again also showing higher numbers of HIV positive partners. And then actually on all three of these graphs, you see the bottom bar is sort of no or other risk, and that's actually the highest, the fastest growing risk factor is other. So actually in all my presentation, I don't like to talk about high risk, I talk about at risk. Because not everybody who's at risk for HIV is going to fit into one of our nice categories for high risk in terms of sexual partners or condomless sex. I also have friends with MDs and PhDs after their names who have HIV or living with HIV and tell me, I don't like anal sex. I never did anal sex. I had to have gotten it from oral sex. And if somebody's only risk is oral sex, they're not going to show up in any of our categories for high risk. So in our program, we really try to just get people who are at risk, and we really train the counselors that if somebody is at any risk at all and they want PrEP, we give it to them. We're not going to say because you use condoms for anal sex all the time, or you don't have anal sex that you can't get PrEP. So a few lessons. So one is a PrEP program can be started very quickly, just using existing facilities and staff, particularly if you're doing ART already. If you're doing ART, you can do PrEP. And the MSM and other at-risk individuals are willing to pay for PrEP if you do it in a friendly environment at an affordable price. So now in Thailand, we have low-cost generics available from India that they make it very, very affordable. And really the demand is out there. If you offer the service and you do it in the right way, the clients are going to find you. So I can say, too, for the Thai Red Cross, we do no advertising, no promotion, no nothing. Everything is just word of mouth or people finding our website. And just finally to acknowledge the Prevention Department of the Thai Red Cross, who made some of the slides for me, and then USAID linkages in Thailand, who also support not the PrEP 30 or 15 project, but some other free PrEP projects in Thailand. Thank you.